Hello, my name is Dr. John Gaal. I am the Director of Worker Wellness for the Missouri AFL-CIO's Missouri Works Initiative. And in that position, I do outreach to various workers across the state of Missouri and industries as well in order to get the word out there with regards to how we might abate the opioid use disorder crisis that we're in, as well as the suicide crisis that we're in, especially among workers. And obviously, if we do a good enough job, that spreads into other aspects of the community. I guess it was probably close to 20 years ago, that researchers from WashU approached me from their school of medicine saying, hey, we want to do research on your apprentices. We want to make sure that your apprentices come home each night safe from the job site. We consider that a public health issue. And it was the first time I really kind of saw that framed as that. And I thought, well, I was pretty open-minded. It's okay, tell me more about it. And of course, they realized that our health and welfare fund was self-funded, so we self-directed it. And so we had a treasure trove of data. Of course, we kept it in confidence. And so we started to do work with them. And we started in kind of what I call the low-hanging fruit. We were doing work in the area of slips, trips, and falls. That led to other issues like musculoskeletal disorders. That led to air nail guns. It's how it was interesting to see how one kind of flowed into the other. And then all of a sudden, when you looked at the calendar, we hit 2007. And if you recall back then, if you're old enough to remember, it was the Great Recession. So our apprentices at the time were coming in 1 week every 3 months. So it wasn't unusual for me to see the same people every quarter, right? And you could just see their demeanor, not just the words they spoke, but the way they carried themselves, how they changed. And that got to me, and I started thinking about it. So I went back to the researchers and said, hey, I don't think we're doing our apprentices justice. And I said, I really think that we need to consider looking at the apprentice as a total human being, from what I think it may use the phrase from 360 degrees. And they pushed back and said, what do you mean? I said, well, I think you're only addressing one half of them, and that's the physical aspects of safety. I said, what about the mental aspects of safety? And essentially they came back and said, well, you know what, we have partners up in Iowa that actually do work in that area, and there's a name for that, and it's called total worker health. And they said, well, we'll start looking into it. And then, soon thereafter, we had the opioids crisis. And then in the industry of construction, soon thereafter, we also had the suicide crisis, that was brought to light. And so we worked together with partners in the industry. I owe a debt of gratitude to people like Don Willey, who was the business manager for Laborers Local 110. Sadly, he lost his son in March of 2016 to a heroin overdose. And that's when it became clear to me that I wasn't doing enough. It actually, in a way, kind of reset my focus on life, because I thought I was doing the right thing and I wasn't even close. And then that's also when it became reality to me that this issue was such a cultural issue, and it had such deep roots in stigma. So I knew Don, I had known Don since high school. And he never once mentioned that his son was afflicted by opioid use disorder. And so that's when the light bulb went in, and I thought to myself, gosh, someone you've known that long, didn't share something that personal, that it's the taboo in our culture, the stigma, you know. And of course, the less we talk about it, the more it remains in silence. And so we kind of partner up, you know, after that happened, and started going to as many conferences and summits and workshops on opioids in the industry as well as the community. And just a year later, in March of 2017, my son had died by suicide. And he came to me and said, you know what, you stood by me in my time of need, and I'm going to do that for you now too. And when we finally both were able to catch our breath, we looked at each other and said, you know what, it's kind of odd that you lost your son to suicide, lost my son to a heroin overdose, and yet we both work in the same industry, construction. And then when we started digging into those numbers, we realized that the construction industry is number one when it comes to opioid overdoses. And depending on what you look at as far as who the recorder of deeds is, or whatever you want to call it, the research, we're either number one or number two, more often number two when it comes to suicide as an industrial sector. And we said that it's not enough for us to sit tight and do stuff just at the local level. We had to start pushing this more towards a statewide, and nationwide, and international levels. And so that's what we've been doing for the last 6 years. And I'm proud to say that it's not difficult to enter conversations on these topics anymore. Now, granted, I'd say COVID has helped a little bit with that, because I think mental health has negatively impacted almost every family on the face of the earth, especially in the United States. And I think with that, it's become safer to talk about issues related to mental health. And so when you create those safe spaces, whether they're at home or work or on the sports field or at church or whatever, it breaks that silence. And when you start to break the silence, you start to break the stigma. And so I think we've come a long way in 6 years, and I'm proud to say that I was a part of that, and have some really good people that I've been able to lean on. The Jennys and Nicoles and the Stacys of the world, here at Prevent+Ed have been a big help. Dr. Anne-Marie Dale, Dr. Brad Evanoff down at WashU, they've been a big help. I've mentioned Don, and I'll miss people if I start trying to name them all off, and so I'm not going to try to do that. And of course, the support of my family. They've been, my wife Mary's just been an angel, and huge support. We often say to each other that if we can help others avoid the tragedy that we lived, then we're doing good work, and it honors our son's memory. So it's important to stay busy, and stay busy for the right reasons, and I think this is really a right reason. So because I've got people who call me back, and it's sad sometimes because it's things didn't turn out the way I'd hoped and prayed for, but other people call me back more often saying, thanks for the help, and that keeps me going. And I think that's what I'm most proud of, is that I've been able to take my family's tragedy and turn it into a positive, if you can do such a thing.